In the fourth section, now we will talk about the dietary advice given to the pregnant women during the pregnancy. And in this, we will talk about the advice about the energy and protein intake during pregnancy, and also about the intake of fats, carbohydrates, minerals, and vitamins. So dietary advice is appropriate diet of appropriate quality and quantity is very important, because malnourishment can cause, or not taking the diet properly can lead to fetal growth retardation, poor nutrition, and also anemia and different folic acid deficiencies that can cause even complications in the mother and the baby. Then gross malnutrition, intrauterine growth retardation, anemia, prematurity, and fetal malformation. These are the pictures of some good diets during the pregnancy: folic acid, vitamin A, B6, fiber is very important, vitamin C, calcium. So all these are the good dietary intakes during the pregnancy. Substantial variation in the nature of diet depending on racial group and actual physical size. So different racial backgrounds have different type of nutrition they utilize during pregnancy. So it's better to avoid these substantial variations during the pregnancy. Energy intake 2000 to 2500 kilocalories per day is necessary during the last 2 trimesters of pregnancy because of demand of both maternal and fetal metabolism. So good 2000 to 2500 kilocalories. Proteins 60 to 80 gram daily, and animal protein is obtained from meat, poultry, fish, eggs, and cheese. So all these are the how much is required and what's the good source of protein. Meat, poultry, fish, eggs, and cheese should be used in the how much servings should be utilized during pregnancy. Always give a good advice to the pregnant women, so they should have a balanced diet. Vegetable proteins occur in nuts, lentils, beans, and peas. So people who are vegetarian and who cannot use the animal protein sources, they can get those proteins from the vegetable sources also. Fat sources, usually essential fatty acids, may play an important role in cellular growth and in preventing the development of hypertension during pregnancy. Important source of energy and source of fat-soluble vitamins, including vitamin A, D, and K. Animal fat are found in meat, eggs, and dairy products, and vegetable fat includes vegetable fat contain unsaturated fats such as linoleic and linolenic acid. So all these, if you notice, meat, egg, and then dairy products, they are very, very healthy, and the use of these should be in the daily diet of the pregnant women. Carbohydrates, primary source of energy for mother and fetus is carbohydrate. Excessive carbohydrates can result in excessive weight gain, so should be used in proper amount, so it should not lead to overweight. Minerals and vitamins, folic acid and iodine supplementations are important, especially if there is dietary deficiency and if there is multiple gestation. Vitamin A and B are found in kidney, liver, and dark green vegetables. These are the sources and how much is serving: dairy, milk, butter, cheese, and for milk is 600 to 1000 ml, butter 150 gram, cheese is 1 serving, meat is chicken, pork, or beef, which is 2 serving, liver is once a week or more, fish once or twice a week. Vegetables, potatoes, other and salads 1 to 2 servings. Fruit is again 1 serving and 2 to 3 servings. Cereals is up to 4 servings. So it's important to follow regular diet plan during the pregnancy. Ascorbic acid is essential for fetal growth and maternal health. Vitamin D deficiency usually should be treated and should be taken proper diet or the other supplements. Folic acid deficiency leads to developmental abnormalities like megaloblastic anemia. So folic acid is important and it also lead to neural tube defect. So folic acid should be used in enough amount. So that was all about the dietary requirements of pregnancy and how much servings of each should be used. Thank you for watching sqadia.com.